Hey everybody, Dr. Kaylee Garrett Zimmerman here. I found a video on spine health knowledge for something, can't pronounce the word, but it's spinehealth.com, and they have lots of really cool videos and a lot of information that you might find fairly beneficial for you. So I'm going to play through the video, but I took their noise out. I just wanted to bring that up front that this is not my video that I made. What I wanted you to see is that you have there's the people that you can look it up. You have 5 vertebrae, 5 bones in your lumbar spine, and you can see L1, 2, 3, 4, and 5, and it's going to go through and lay those out for you as well. You can see that you have those 5, and it's right below the thoracic spine, which is the larger area of your back, and then also above the sacrum. It's increased lordosis, which is just a reason or a curve that they give the low back is made with in order to absorb shock and to take on more load. So your low back actually gets quite a bit of load, especially L4, 5, and L5, S1, which are those lower segments of the spine. You have a lot of large muscles that attach to the low back, and we're going to look at those muscles here in just a moment. But you have a deep layer, an intermediate layer, and then a superficial layer. And then you can see how they're connected and how they move. Your lumbar spine gets quite a bit of movement in forward or backward or rotation and even side bending. L5, S1 takes the most of that load, and that's why it is the most common to be injured. You can see how it's attached to the sacrum, and that's why it can be injured. But these are the discs. You can see that there's lumbar discs between, and that's where you get the words herniated disc. You can get the nerves coming out. The disc can swell and actually compress the nerve, and we're going to go over these diagnoses a little more specifically here soon in the next course of this video. But you want to be able to understand the anatomy first. So again, the main things is that you have 5 vertebrae in the lumbar spine. Each lumbar spine attaches to the one below it and above it as far as the bone goes. You have nerves that come out of the lumbar spine on the side, and you have a disc between each of those vertebrae or each of those bones. If the disc gets swollen or injured, then it can compress the nerve, which is what is a very common injury when we think of sciatica or we think of anything like radiculopathy, which we're going to be reviewing here shortly. You can see that the relation of the nerves and the discs are very close, and you also want to remember that L5-S1 carries the most load. This is a picture that I found that's going to show you those outside layers. Of course, if you take your skin away and all the fascia and all the fat, you're going to see all of these muscles here in the back. The ones in the low back that you want to think about is you have this fascia, which is a connective tissue layer, and that's a lot of times what can cause pain and discomfort in your low back region. You see your latissimus dorsi, which a lot of us falsely think is just a shoulder muscle, but it can actually cause a lot of low back pain. You can see how large that muscle is. You've got your obliques, which is part of your core. Very important to learn about what your obliques are doing and if they are overacting, because if they are overacting, then you want to make sure that you are detraining those and decreasing the activation. You can see the close proximity or how close the glute muscles are to the low back, so you can actually get back pain if you don't have the proper working muscles in the glutes. If you peel away that top layer, mostly that latissimus dorsi, and get some of that fascia pushed out of the way, you could start looking at these other muscles. Your erector spinae is a muscle I find to be quite commonly irritated. It likes to tighten and overwork, especially when we're having pain in the actual joints of the lumbar spine or when our discs are not working appropriately. I also want you to pay attention to how close this 12th rib, the lower rib here, is to your lumbar spine. I find a lot of times when I'm treating the patient for low back pain, it's actually a dysfunction here in the thoracolumbar junction, we call it, where that thoracic spine meets the lumbar spine. And then they're not able to breathe appropriately. They're not getting good control of their diaphragm, which was that previous series. So you can see all of these muscles here. And then if I click on this one to show you the deeper layers, you can again see all these specific names. You can see here, which is one I wanted you to see, is the Transversus Abdominus, which is a very important core muscle. And it goes straight across and the abdomen and also back here, and I want you to realize that that attaches to the front of your spine. So core control, stabilization, strength and control is very important for any of us trying to get rid of that back pain. And I think that those are really the main ones that I wanted to show you today. You can kind of see here, you've got different specific names of muscles, and they can attach all the way down into the sacrum. You've got a lot of muscles that attach just between the vertebrae. And you've got a lot of muscles that are just specifically right between each vertebrae on top of the other. But keep in mind that a lot of the muscles that you have attach down into the sacrum. So the low back can affect the sacrum, which can affect the hips. And then you also have a lot of muscles that attach throughout the thoracic spine. So thoracic spine pain can lead to lumbar spine pain, or lumbar spine pain can lead to thoracic spine pain. I always tell patients when they have low back pain, which is very, very common, and 100% of us get low back pain at some point in our life. About 80 to 86% of patients that come to physical therapy to see me, and that's just my basic specific stats, is a low back pain patient. But I never treat one part of the spine and not the rest. We can't look at the lumbar spine and only look at the lumbar spine. You have to look at the whole spine as a whole, because it goes all the way up from your cranium all the way down through that sacrum into the tailbone. So we have to be able to specifically assess and look at all of those different areas of your low back. Hopefully that brought a good light and a vision to you to kind of know what's going on there in your back, what it looks like. The next video that we're going to do is going to be specific diagnoses, things that can go wrong and cause pain, and then we'll learn about assessment and then a little bit of treatment. Let me know if you have any questions. Thanks, guys.